Did you know that prostate cancer stands as one of the most prevalent cancers among men globally? Despite its widespread nature, many overlook the subtle signals that can herald the onset of this disease. Today, we're diving deep into the essential early symptoms that must never be ignored, exploring the most significant risk factors, and outlining the preventive measures every man should incorporate into his life. Stick with us to learn how to recognize changes in your body, helping you ensure not only effective treatments when necessary but also a high quality of life. Understanding the role of the prostate and how cancer develops. The prostate is a small yet crucial gland nestled within the male reproductive system, positioned just below the bladder and in front of the rectum. This tiny gland plays a pivotal role, producing part of the seminal fluid, crucial for nourishing and protecting sperm. However, the balance of this gland can be disrupted by conditions like inflammation, known as prostatitis, or by the emergence of abnormal cells, adversely impacting overall health. Prostate cancer begins when prostate cells start mutating and multiplying uncontrollably, potentially leading to tumor formation. While often a slow-growing condition, prostate cancer can, in some cases, become aggressive, spreading to other parts of the body. Understanding the function and location of the prostate is essential for recognizing warning signs early and taking proactive measures. The critical benefits of PSA tests and digital rectal exams. Detecting prostate cancer early forms the cornerstone of successful treatment strategies. In its early stages, this disease may not exhibit clear symptoms, leading many men to unwittingly remain undiagnosed. This circumstance emphasizes the importance of routine screenings like the PSA prostate-specific antigen test and the digital rectal exam. Early detection can dramatically improve the chances of successful treatment outcomes and allow for therapeutic approaches that are less invasive. Sadly, stigma and discomfort surrounding the digital rectal exam prevent many men from pursuing these essential evaluations. Prioritizing your health over cultural stigmas or discomforts is vital. These actions can literally save lives. Unpacking key risk factors: age, genetics, race, and lifestyle habits. Several significant risk factors are associated with prostate cancer. Age is one such factor. Men over 50 have a considerably heightened risk, though cases of early-onset prostate cancer do occur. A family history of the disease also plays a crucial role. If your father or brother has been diagnosed, your risk increases substantially. Race is another important factor, with Black men statistically facing a higher likelihood of developing prostate tumors compared to those from other ethnicities. Moreover, lifestyle choices significantly contribute to risk. Diets high in animal fats, physical inactivity, and excess weight all contribute to the onset and progression of cancerous cells. Fortunately, these risk factors can often be mitigated by adhering to a healthy diet and engaging in regular physical activity, reducing overall risk. Early symptoms you should never ignore. 1. Changes in urinary stream. A frequently noted symptom is a change in urinary flow. You might experience difficulty starting urination, a weaker urine stream, or interruptions during bladder emptying. The persistent sensation of not being able to completely empty the bladder often occurs, causing both discomfort and anxiety. While these signs are sometimes linked to benign prostatic hyperplasia, they can also indicate early stages of prostate cancer. If you notice changes in your urinary patterns, seek medical evaluation without delay. 2. Increased nighttime urination frequency. Frequently waking to urinate at night, a condition known as nocturia, is another symptom that many men tend to overlook. This problem can be caused by several conditions, including infections, poorly controlled diabetes, or prostate enlargement. An enlarged prostate exerts pressure on the bladder, prompting frequent urination urges and consequently disrupting sleep. This disruption can lead to fatigue and irritability, negatively impacting overall quality of life. While this might appear to be a normal part of aging, should symptoms worsen or be accompanied by pain, a visit to your doctor is merited. 3. Presence of blood in urine or semen, hematuria, blood in the urine, or hemospermia, blood in the semen, are alarming symptoms requiring immediate attention. Although these signs may have various causes like urinary infections or kidney stones, when linked to the prostate, they could indicate tumor lesions. These symptoms often appear in more advanced stages of prostate cancer, though each case is unique. If you notice blood in bodily fluids, seek a medical evaluation swiftly. Imaging tests, laboratory analyses, and sometimes a biopsy may be essential to determine the underlying cause. Proactive measures and moving forward. While prostate cancer can pose a life-threatening challenge, early detection combined with preventive measures make a world of difference. Here are some actionable steps you can take. Schedule regular screenings. Annual PSA tests and digital rectal exams are crucial, particularly for men over 50 or those with a family history of the disease. Embrace a healthy diet, focusing on fresh fruits, vegetables, whole grains, and lean proteins, while limiting red and processed meats. Stay active, as regular exercise helps maintain a healthy weight, improves circulation, and minimizes overall cancer risk. Listen attentively to your body, don't disregard subtle changes. Early symptoms can be managed effectively when caught in time. Drawing conclusions, take charge of your health. Prostate cancer is indeed a serious health concern, but with awareness and proactive steps, outcomes can be significantly improved. By acknowledging early symptoms, understanding your risk factors, and committing to preventive care, you empower yourself to take control of your health and well-being. Your health should always be your top priority. Don't let fear or stigma prevent you from accessing the care you need. Remain vigilant and regularly consult with your doctor, empowering yourself with the knowledge to protect your body. Early action not only saves lives but also ensures a richer quality of life. Recognizing prostate cancer symptoms, what every man should know. Prostate cancer poses a significant health challenge for men worldwide. Even subtle symptoms should never be ignored, as early recognition can determine treatment efficacy and outcomes. This guide is here to help you identify key warning signs and understand the importance of timely medical attention. Additional symptoms: pelvic pain, changes in ejaculation, and erectile dysfunction. 1. Pelvic pain or discomfort. Pelvic pain is frequently tied to inflammation or muscle issues, but remember, the pelvic region also houses vital organs like the prostate. Persistent discomfort or sharp pain in your lower abdomen, lower back, or genital area might signal tumor growth. This discomfort can even extend to your back, complicating tasks like walking or prolonged sitting. In advanced prostate cancer stages, such pain might be relentless. Many patients mistake it for muscle strain and delay crucial medical evaluation. Persisting pelvic or lower back pain should never be dismissed, as it could signify a serious condition. 2. Changes in ejaculation. Prostate cancer can directly impact the processes involved in seminal fluid production and sperm release. Changes like reduced semen volume or painful ejaculation should never be ignored. While often mistaken for infections, persistent symptoms like these deserve close attention. Tumors compress vital nearby structures, altering duct functions responsible for semen transport, a change that can result in modified texture, color, or fluid quantity. If these symptoms persist or worsen, immediate professional evaluation is crucial. 3. Difficulty maintaining an erection. Erectile dysfunction (ED) can arise from numerous causes, including diabetes, circulatory problems, and drug side effects. However, prostate gland changes might contribute, especially if tumor cells disrupt blood flow to the corpora cavernosa of the penis, hindering erection maintenance. If ED arises suddenly or worsens progressively, deeper investigation is essential. A straightforward urological checkup can determine whether the cause is prostate cancer-related or due to another condition. Early intervention enhances quality of life and ensures proper issue management. For a feeling of bladder pressure, regular sensations of a full bladder even post-urination are common complaints among men with prostate issues. Often a symptom arising when an enlarged prostate generates a partial obstruction preventing complete bladder emptying. This condition results in residual urine, which, over time, can cause discomfort and force men to strain their abdominal muscles during urination. Untreated, it may result in complications like recurrent urinary infections, as leftover urine fosters bacterial growth. Persistent bladder pressure demands specialist consultation and imaging or laboratory tests. 5. Unexplained weight loss. Unplanned weight loss often signals various cancers, including prostate cancer. Particularly in advanced stages, tumors trigger metabolic changes and appetite loss, significantly reducing body weight. Accompanying fatigue, paleness, and weakness should escalate concern. If your clothes become looser and appetite dwindles for unclear reasons, urgent medical evaluation is imperative. Although weight loss could originate from conditions like hypothyroidism or gastrointestinal issues, thorough examination is necessary to eliminate concerns like cancer. 6. Fatigue and persistent tiredness. Relentless fatigue that fails to diminish during ordinary activities indicates a potentially serious underlying issue. Tumor growth redistributes a body's energy reserves, sparking metabolism alterations that hinder nutrient absorption and tissue oxygenation. This chronic tiredness dramatically impacts productivity, mood, and general quality of life. Unexpected energy declines unlinked to habit changes or increased stress require prostate health consideration. Persistent fatigue combined with other symptoms warrants immediate medical attention. The vital role of routine exams in detecting prostate cancer. Detecting prostate cancer relies heavily on exams like the PSA test and the digital rectal examination. The PSA test measures levels of a protein produced by the prostate. Elevated PSA levels, though not definitive of cancer, can be alarming. These checks enable the assessment of the prostate gland's texture, size, and shape, vastly improving detection accuracy. In some cases, further imaging tests, like MRIs or transrectal ultrasounds, might validate diagnoses. Never dismiss these signs. Prostate cancer frequently progresses quietly, intensifying the need for early detection. Symptoms like pelvic pain, changes in ejaculation, erectile dysfunction, bladder pressure, unexplained weight loss, and pervasive fatigue must never be overlooked. Routine screenings and medical evaluations are critical defenses against this disease. Experiencing such symptoms or noticing unexplained health changes requires specialist consultation. Your health deserves priority awareness and early action. Safeguard quality of life and enhance treatment results. Remain informed and proactive. Prostate cancer. Insight into prevention and hope. Understanding prostate cancer's signs, risk factors, and treatment alternatives is pivotal in responding effectively. Let's delve into how regular screening, lifestyle reform, and breaking men's health stigmas foster early detection and improved results. Regular exams should become routine, especially for men over 50 or starting at 45 if risk factors are present. Consultations with specialists are essential, wherein PSA tests and digital rectal exams detect anomalies early. Checkup frequency should align with discussions involving both doctor and patient based on personal risk considerations. Upon confirming malignant cells via diagnostic tests and biopsies, tumor staging allows for customized treatment plans. Honest communications with healthcare providers and second opinions bolster support during challenging phases. Treatment options and potential side effects. Approaches for managing prostate cancer vary depending on disease aggressiveness, stage, and the patient's health. Each carries benefits and possible side effects. Radical prostatectomy. This surgical method excises the prostate completely, often proving effective for localized cancer. However, side effects, such as urinary incontinence and erectile dysfunction, might emerge. Radiation therapy, be it external or via brachytherapy, radiation therapy targets tumor cells effectively. Common side effects include fatigue alongside bladder and rectal irritation. Hormone therapy, by lowering testosterone levels, hormone therapy decelerates tumor progression. Hot flashes, bone density loss, and reduced sexual desire are potential side effects. Chemotherapy, primarily targeting advanced-stage prostate cancer or treatment-resistant cases, chemotherapy presents varying side effects, including fatigue, nausea, and diminished immunity. While every treatment entails risks, success rates remain high when therapies undergo proper selection and administration. Sustaining quality of life during and after treatment. Managing side effects while sustaining a quality life remains crucial throughout prostate cancer treatment. Multiple strategies contribute. Physical exercise. Engaging in supervised activities and pelvic physiotherapy fortifies the pelvic floor, advocating better urinary control and reducing incontinence. Nutritional support. A balanced diet underpins immunity, accelerates recovery, and replenishes essential nutrients integral to the body's defense mechanisms. Lifestyle changes for prevention and recovery. Embracing focused lifestyle changes is a robust strategy in navigating both the prevention and recovery phases of prostate cancer. It's more than just a regimen, it's a holistic approach that encompasses not only physical health but emotional resilience as well. Psychological support. Handling the psychological turmoil that accompanies a prostate cancer diagnosis is critical. The emotional burden can be lightened through steadfast encouragement from family, friends, or support groups. Engaging with professional counseling can also provide a safe space for expressing fears and anxieties. Facing prostate cancer is undoubtedly challenging, but leaning on loved ones and seeking professional help can significantly mitigate anxiety and foster stronger mental health. The role of a balanced diet. Diet serves as a fundamental pillar in both preventing and managing prostate cancer. Consuming foods abundant in vitamins, antioxidants, and fiber, such as fruits, vegetables, legumes, and whole grains, helps fend off free radicals and reduce inflammation. On the other hand, an overconsumption of fatty red meats, processed foods, and ultra-processed snacks can spur inflammation, thereby increasing the risk of cancerous cell proliferation. A Mediterranean-style diet, emphasizing fish, olive oil, and an array of vegetables, has shown considerable benefits for men's health. Additionally, moderate soy product consumption may positively influence hormonal balance, offering yet another layer of dietary defense. Beyond diet, exercise and lifestyle, physical activity and maintaining a healthy weight are powerful tools in cancer prevention. Regular exercise not only fortifies the immune system but also regulates insulin levels and diminishes chronic inflammation. In stark contrast, a sedentary lifestyle can lead to fat accumulation, hormonal disruption, and a heightened risk of mutations. Incorporate enjoyable and manageable activities such as walking, swimming, or cycling into your daily routines. Pursuing these under professional guidance guarantees both safety and efficacy, making exercise a sustainable and enjoyable part of daily life. Mental health matters. Stress and anxiety aren't mere inconveniences. They can exacerbate inflammation and create an environment conducive to tumor progression. Therefore, managing mental health through mindfulness, meditation, or cherished hobbies can greatly enhance overall well-being, contributing to a more resilient mental state. Breaking stigmas around men's health. The reluctance among some men to engage in discussions about health issues, especially intimate ones, remains a significant barrier to early prostate cancer detection. Discomfort or embarrassment regarding procedures such as the digital rectal exam persuades some men to avoid this vital screening, despite its life-saving potential. However, awareness campaigns like Movember aim to dismantle these taboos. Encouraging open discussions about symptoms with friends and family, and promoting routine exams, can normalize male healthcare conversations and facilitate early problem identification. Vigilance during and after treatment. For those navigating or completing treatment, maintaining regular follow-ups is essential. This vigilance includes repeated blood tests, imaging scans, and consultations with healthcare professionals. Although this rigorous follow-up routine may cause apprehension, it ensures any recurrence or progression is detected early, capitalizing on the high cure rates for prostate cancer with early detection. Moreover, continuous advances in medical technology and treatment protocols are steadily improving outcomes, offering hope and greater possibilities for those affected. Proactive health management and the importance of follow-ups. Adopting a preventive mindset is crucial. If unusual symptoms arise or if you possess familial risk factors, seeking prompt medical attention is imperative. Being armed with knowledge, engaging in routine screenings, and adopting a proactive approach are invaluable allies in the fight against prostate cancer. Final thoughts. Prostate cancer presents a formidable challenge, but it is one that can be met with early detection, tailored treatment plans, and meaningful lifestyle adjustments, all of which can dramatically improve outcomes. Maintaining a balanced diet, staying physically active, and giving due importance to mental health form the core of effective prevention and recovery strategies. Awareness and open dialogue are paramount. Breaking down taboos and committing to regular health checkups enables men to safeguard their well-being. Should you notice any symptoms or harbor concerns about your prostate health, consult with a doctor without delay. Remember, early detection coupled with prompt treatment not only saves lives but enhances them. Take charge of your health confidently and proactively. Disclaimer: the information provided here is based on reliable medical sources, but it should not replace professional healthcare advice. Always consult a qualified medical professional for any concerns or symptoms you may experience.